I'm Stacy Darnell, one of the care managers with Assisting Hands of Brevard. This is Anna Kate, another one of our care managers on the team. Today we're going to be going through taking vital signs the proper way and the proper normal values. First of all, you want to make sure that you have your equipment nearby. Right now we're going to use an automatic blood pressure cuff, and what I'm going to do is to make sure that the client is at rest for at least 5 minutes prior to taking any kind of measurement so that we get something that's accurate and not skewed by activity. So the next step would be to apply the blood pressure cuff. Most blood pressure cuffs do have a photo on them just to show you proper application. What we're going to do now is make sure that the client is sitting, if possible. Feet are flat on the ground and no talking during the blood pressure measurement. So I'm going to apply the cuff here to Anna's arm. And we want to line that up so that the marking for the artery is an inch above the crook of the elbow. When you apply the cuff, you want to make sure that it's snug, but you want to be able to have at least one finger able to be placed underneath so that it's not too tight. Once you get the blood pressure cuff placed, then you'll hit the start-stop button or the on-off button and make sure that the client stays calm and does not speak. The cuff will then pump up and you can kind of let them know what's going to happen so that they're aware and don't get startled. So now that the cuff has deflated, we have the reading for the blood pressure, which is up on the screen. Systolic over diastolic, and then we will also get a reading for the heart rate as well. So Anna's reading 105/69 with a heart rate of 76, which is a fairly good reading. Normal reading should be around 120/80, but can vary from client to client. So if the client is alert and oriented, just kind of ask them what your normal reading is, what your normal baseline is, and then that way you're able to kind of gauge, hey, is this really high? Is this really low for the client? Another form of equipment that can measure blood pressure you may have encountered is a wrist cuff. So you would want the client to still be at rest, as you would with the upper arm cuff. You would apply the wrist cuff to the client's wrist. I'm gonna have you turn your wrist up, Anna, because we want that monitor on the inside of the wrist. You want that 1 inch above the wrist area. You want to then hit the start-stop button or on-off button, whichever is listed on the machine. And then once that starts pumping up, you want to ask the client to go ahead and reach that up to your heart. That way we can get a good blood pressure reading. So now as that pumps up, Anna, you're going to feel some pressure. And then once it's ready to read, then it will release and then give you the reading on the monitor. Once again, you want the client's feet flat on the floor, no talking. If the client is unable to sit, then they can be horizontal in bed, still at rest, no talking. So then you'll have the client rest their arm down, you'll get the reading, and then afterwards, just undo the Velcro and release the cuff. Now we're going to read the oxygen saturation level in the blood. This is called a pulse oximeter or a pulse ox. What you would do is you would turn it on, and then when it lights up, you're going to squeeze the end and put it on the index finger or really any finger you can use for the client. And after a few seconds, it's going to give you a heart rate and then the oxygen saturation in the blood for the client. Normal heart rate should be between 60 and 100, which this can also vary client to client. If somebody's in really good shape, their heart rate may be lower, or if they're on a medication to slow down the heart rate, that also may lower the heart rate as well. So right now, we're getting a reading of 94, which is the percentage of oxygen in the client's blood right now. And we want a normal oxygen reading between 95 and 100. Normally, if it's at least 92, that's okay. It's on the lower end, but anything under 92, then supplemental oxygen may be needed. Anna's heart rate, as you can see here, is 80 beats per minute, so she is within the normal limits of heart rate. If the oxygen level is below 92%, that is an emergency and you would need to contact for medical attention.